Today topic of discussion respiratory system drugs for asthma. How does asthma occur? What is asthma? Complete respiratory tract. We have trachea and we have bronchi. So that divides into bronchioles. So trachea and bronchi are hypersensitive. So in this part, hypersensitive. In the asthma of trachea and bronchi are hypersensitive. See, this is the normal trachea. And this is the person who have asthma. Compare that trachea and bronchi. In some persons, okay, in some allergen, it may be dust particles or pollen grains or any perfume or any chemicals is going in a normal person trachea. His trachea do not contract. He do not have broncho constriction. Okay, he don't have broncho constriction. It is going inside his body, having corpuscle and ciliary. They will take care of that foreign particles. But if the person who have that asthma, okay, he have asthma, there are very hypersensitive. As soon as that particular stimulus, different people having different stimulus. For some, the stimulus is dust. For some, the stimulus is pollen grains. For some, the stimulus is some chemicals. So, whenever that particle stimulus is going the trachea and bronchi undergo spas. It is a productive mechanism. Body don't want dust to go inside. Just imagine lumen of trachea, there is a dust particles. But a normal person trachea is allowing it to go inside because he is not hypersensitive. He don't have asthma. He is having alveolar macrophages and having ciliary action. He is having other defense mechanism of action that will take care of the foreign particles or dust particles. If the person having asthma and in that lumen of trachea, bronchi will not allow the dust particle to go inside, and trachea will go spas, broncho will undergo spas. So it is the productive mechanism. So in the body is trying to prevent the foreign particles to go inside. The dust will go inside, like person can't breathe. Person have attack of asthma during which the person have dyspnea. The person can't breathe because undergo spas. Air cannot go inside and outside. Person cannot do the breathing dyspnea. So the person try to relieve that person, do that cough, and the person have wheezing because of lumen is narrowed, the pipe narrowing. Now air when passing from that widened lumen, no sound is there, but when the same air passes from the narrowed lumen, there is a particular sound that is called as wheezing. So normal person no sound, here narrowing, so it extra sound will come, that name is called as wheezing. Asthma is a disease. So what is asthma? Asthma is a disease in which three things are happen. What are the three things will happen? Dyspnea, wheezing and cough. This is asthma. This is spas. So there is narrowing bronchi and trachea. Asthma is a disease. This one because of variety of stimuli, it affected that tracheobronchial tree. So here widespread spasmodic narrowing of air passages. So spasmodic location trachea and bronchi, etiology allergen. It may be chemicals, anything, allergen particles. So it causes three type of disease: cough, wheezing, and dyspnea. Now we want to discuss that mechanism. Now discuss that mechanism. How does it occur? Imagine a person, asthma person. This is the allergen. Okay, this is the dust particles or pollen grains. As soon as these allergen enter, five cells will come one by one. So here five different type of cell comes under that action. We have to learn the sequence, then only we can understand the drugs. So allergen is going to inside the first cell which comes in contact here, that is antigen presenting cell. When this antigen presenting cell will inhale that antigen, so this one is the antigen allergen particles, now it will inhale. So this antigen enhelped by antigen presenting cells, it is degraded into multiple pieces. After degrading into these multiple pieces, it is presented on the surface of antigen presenting cell. So it is presented on the next cell. The next cell is T helper 2 cells. It will get stimulate and secreted interleukin 4. It will secreted inter this T helper 2 cell stimulated and secreted interleukin 4. So it secreted interleukin 4 from inside. Interleukin 4 will go to the next cell. The next cell is B cell or beta lymphocytes. B cell or beta lymphocytes. The B lymphocytes will converted into plasma cell. The B lymphocytes will converted into plasma cell. The plasma cell will form antibodies. Which antibodies? There are five different type of antibodies: IgA, GAMED. So this one it will form IgE antibodies. Only IgE antibody. This IgE antibody will go to the last cell. It will go into the blood. It will go on that in blood we have mast cell. So this IgE antibody will get deposited on that, so will get deposited on that surface of the mast cell. So deposited like this, it will remain there forever and ever, and this is known as sensitization. This one always presented on that mast cell. This process name is called as sensitization. It will be there forever. The first time allergen is entering, nothing will happen. Allergen will not happen. Okay, asthma will not happen. First time not happen. Imagine the same antigen enter the second time, second, third, fourth time, any time, second time onwards. So as soon as it will enter the same allergen, this complete things is done in our body. So now the same antigen is entering again, same antigen entering again. Here antigen presenting cell will recognize the body have immunity or memory, a very strong immunity memory. If the same antigen is entering, even after many years, the body can recognize it. Antigen presenting cell will recognize that. So here what it will do, we will not repeat that process. Okay, we will not repeat this process. Directly go to your antibodies. So this antigen directly will go to antibodies. The second time onwards, it is diverted directly diverted to antibodies. So this will come to its antibody and bind here. The antibody is not free. The antibody is presented on the surface of mast cell. As soon as antigen binding on the surface of antibody, it will give signal to mast cell. So it will here binding, after that it will give signal to mast cell. The mast cell ruptured. After that here this mast cell ruptured, the granules will come out. The mast cell having granules will come out. Mast cell will rupture and granules will come out. The granules containing many things. The most important thing, leukotriene. It containing prostaglandin, also it containing platelet activating factor, histamine, serotonin. But the most important one, leukotriene B4 and C4. Leukotriene B4 and C4. Now this one is the trachea. So this one is the trachea. The trachea of the person who have that asthma, inside which this all happen, all the mechanism will happen inside the trachea of that asthma patient, inside which all the things is happening on the surface of the trachea. Okay, the surface of the trachea, and that broncho leukotriene receptor are present here. It having receptor, that trachea having receptor, that name is called broncholucoderine receptor are present. So leukotriene will come, so here it will releasing leukotriene, so it will come and bind here. So leukotriene will come, bind with its receptor and causes broncho construction. This is how asthma occur. Here we have 5 drugs for asthma. So this is how asthma takes place. Imagine there are two patients, patient A and patient B. Patient A already have an attack of asthma. Now he want to prophylaxis and he want that next attack to not come. Currently attack is not there, so he want prophylaxis. Patient A want prophylaxis, but patient B is currently dyspnea, wheezing. He attack an asthma. Now only have attack on asthma. He want treatment. So A want prophylaxis, B want treatment. So drugs for prophylaxis of asthma and drugs for treatment. Okay, so what are the drugs we are using for prophylaxis and what are the drugs we want to use it for treatment, we want to discuss. So prophylaxis of asthma, the drugs for the treatment. First drugs, antibody against this antibody, IgE antibody. Okay, antibody against this IgE antibody is known as omalizumab. Omalizumab. If that antibody, IgE antibody get neutralized, so when we are taking drugs, this antibody get neutralized. Imagine if IgE antibody get neutralized, so IgE antibody will not come on that mast cell. And if this antigen is entering second time, IgE antibody is already neutralized. The attack will not come, so we can give antibody against the antibody, that is known as omalizumab, number 1. So drugs we want to give antibody against the antibody first. If we are not giving antibody against the antibody, that omalizumab, number 2, we can give a drugs which is known as muscle that stabilizers. So even this antigen is coming second time, it is coming and binding here the mast cell. Okay, this mast cell will not ruptured because it stabilized. it will not rupture. So the drugs is known as mast cell stabilizer. So second drugs we want to give mast cell stabilizer. So first drugs is antibody against antibody. First drugs. Second drugs the mast cell stabilizer. Either we neutralize the antibody. If we are not neutralizing, it's okay. Let it bind with the mast cell stabilize. The mast cell ruptured. When that antigen is coming the second time, it will go here, it will bind and it will ruptured. So leucoderine will come out. Now leucoderine will come out. Give leucoderine antagonist. Give leucoderine antagonist. So here rupture, it will releasing leucoderine. So we want to give leucoderine antagonist. When the mast cell rupturing, leucoderine are synthesized inside the mast cell. Now one more drugs, the leucoderine is present at that mast cell. Now once the mast cell is ruptured, then leucoderine is coming out. So leucoderine is synthesized from the phospholipid. So here phospholipid. So we can give steroids also. Steroids inhibit the synthesis of leucoderine. You can give steroid. So synthesis either inhibit synthesis or antagonize it or block it receptor. So we can give steroid also. Third one is steroid. So here steroid we can use. Antibody against IgE antibody first. Second one is mast cell stabilizer. Third one is that if we want to inhibit, so we can use steroid. Here we are using leucoderine antagonist. So no leucoderine will not go and bind with its receptor. So either give antibody against the IgE antibody, or if you are not neutralizing it, stabilize the mast cell. So even if the antigen is coming, it is not rupturing. The granules are not coming out. So give ketotifen, that is the mast cell stabilizer. If you are not stabilizing it, okay, let's it's ruptured. The granules will come out. The granules containing leucoderine. So give leucoderine antagonist, that is sutone. If we are giving leucoderine antagonist, it's okay. Then it will go via blood. It will go via blood and bind on its receptor. It will bind on receptor on the trachea. So block that receptor. So we want to block this receptor. So block the receptor of that leucoderine. You are not antagonizing the leucoderine, so block it receptor. So at least they cannot bind with it receptor. So leucoderine receptor block are there. So these are the 5 drugs we can use for prophylaxis. So what are the 5 drugs? One is antibody against the IgE antibody. Second one is mast cell stabilizer. Third one is steroid that inhibits synthesis of leucoderine. Fourth one is leucoderine antagonist. Fifth one is leucoderine receptor blocker. These are the 5 drugs we can use for prophylaxis. Imagine the person be attacked, giving these drugs for prophylaxis for the next attack. So if the antigen is entering the second time, attack will not occur. Either antibody already neutralized or the mast cells stabilized, or inside mast cell leucoderine is not synthesized, or leucoderine is antagonist, or the receptor are blocked. So this is for prophylaxis. But if the patient already have that attack, nothing will work. You have to do the bronchodilator. Patient B now currently he have attack, so we want to give bronchoconstrictor. So only one we want to give, that bronchodilator drugs only. Bronchodilator drugs for treatment, remaining all the things, all the five things for prophylaxis. So bronchodilator only for treatment, remaining these five things used for prophylaxis. Now drugs list.